Hi, my name is Sebastian and I'm presenting seated immersive exergaming for fall prevention of older adults. I give a quick introduction of our project Exergaming, where we develop exergames in virtual reality for the treatment of neurological diseases, and we focus on a multitude of different training scenarios for older adults, including seated VR exergaming. 1 in 3 people over the age of 65 fall annually, and the majority of these cases is balance disorders. These falls, of course, can be detrimental to these patients. Seeing here a fall as a cause of death by age bracket, but also these falls can cause psychological problems such as fear, physical impairments, and in turn, again, increase the risk of falls. Sitting requirements, which we found out through interviews with patients, clinicians, and physicians, mainly focus on having both the patient and clinician feel safe when using VR. If possible, of course, we do not want to exclude anyone who joins the session because through word of mouth, a lot of people find out we're doing these studies, and at the senior home, they will then ask their clinicians again if they can join these studies, and if they can through some impairment reasons, like if they're only sitting, etc., this would be very bad for our study and the program in total. So some exercise programs such as the Otago feature catalogs of movement, but these movements often focus on exercises which involve sitting up and standing down, which in VR might cause problems when clinicians are supposed to run these games with their patients alone, because standing up and sitting down is because you don't see the chair in most situations, very unsafe for these people. VR exercises, which we developed with the physicians at the hospital, always had to be two-folded. So one, of course, these exercises should improve the balance disorder, but at the same time also improve day-to-day tasks to improve the overall well-being. This is also very important for clinicians because when they explain their patients why they are doing the exercises, imagine a patient with dementia, for example. They cannot they cannot tell the patient, well, you have fallen like a few months ago, so we're doing these exercises to again pep you up. But these patients might not remember this, or might again then feel unsafe. So they are told instead that they are doing exercises to improve their day-to-day tasks by, like, for example, reaching for a book in the bookshelf or moving a cup across the table. So we have an example of a very dynamic exercise where the patient, here our student, moves an object from the left to right, moving their center of mass. And this resembles when you are, again, moving an object from one spot to a different one. These exercises should always focus on a single aspect, so they should not combine different things. So he or she is like only focusing on this object. This is a simple task anyone can do. Unless, of course. Another task would be leaning and rotating the head. If you only focus on doing this by, like, searching your surrounding, this resembles people holding conversations. So if someone's sitting in a wheelchair or often sitting at home reading book, watching TV, they might not move their head as much, and this stiffens the neck, and this exercise again will make the people move their head more often. Our exergame has people doing these tasks by, first of all, showing them objects in 360-degree video, where the people can use the camera to take pictures of the surrounding, and at the same time look around and figure out where they are in the surrounding when questions are asked. So we did plan to run a 2-month study, but this is, of course, now delayed. But at the same time, we're discussing what other means we can use to improve our exergame, and we're communicating with the clinicians on a weekly basis and the physicians as well, of course. So thank you for your time. Feel free to contact me, and stay safe.